He was only 35. A man in his prime, strong, active, the kind of person no one would ever think of as sick. Friends saw him as reliable, his family leaned on him, and to the outside world he looked perfectly healthy. But inside his body, something else was happening. For weeks, he had been feeling worn out. Not the kind of tired that comes after a long day, but a heaviness that lingered no matter how much he rested. At first, he pushed through it. He still showed up to work, still made it to family dinners, still tried to laugh at the little things. He didn't complain much. Maybe it was stress, maybe poor sleep, maybe nothing at all. Then came the waves of nausea. Subtle at first. A sour stomach after lunch. An unsettled feeling late at night. Easy to dismiss, easy to ignore. After all, who hasn't felt run down before? But on one evening, everything changed. He was standing in his living room, speaking with his wife, when his body suddenly gave out. His knees buckled, his vision blurred, and he collapsed to the floor. His wife's panic filled the room. Moments later, the sirens of an ambulance cut through the quiet street, and flashing red lights lit up the night. At the hospital, doctors worked quickly. Blood was drawn, monitors beeped, oxygen flowed. They were looking for answers, something that could explain how a man so young and seemingly well could suddenly lose control of his own body. The tests revealed a truth he never imagined. His blood carried a virus that had been silently attacking his liver for years. It had waited patiently, leaving only small hints of its presence: fatigue, nausea, a subtle yellowing of the skin that no one noticed until it was too late. And here is the most unsettling part. He was not alone. Millions of people are living with the same infection right now, unaware, carrying it in silence. Some will discover it by accident. Others will only learn about it when it is already too late. Every 30 seconds, somewhere in the world, another life is lost to this same illness. Yet the first sign can be so ordinary, so familiar, that most people dismiss it without a second thought. Stay with me until the end, because the symptom that brought this man to the emergency room may be the very one you've already felt yourself. And what doctors uncovered in his blood could be the most important warning you'll ever hear. When Michael arrived at the hospital, his family was in shock. To them, he was young, hardworking, and full of life. A collapse like that felt impossible, almost unthinkable. But here is where his story takes a turn that should make us pause, because what he felt before that night is something almost everyone has experienced. Michael had been tired. Not once or twice, but constantly. The kind of exhaustion he thought came from long hours at the office. He had waves of nausea, nothing severe, nothing alarming, just moments he blamed on the food he ate. These were the only clues his body gave him. And here's the unsettling truth. Those same symptoms could happen to you, to me, to anyone. Fatigue. A loss of appetite. A stomach that doesn't feel right. We dismiss them every day. We tell ourselves it's stress or lack of rest or something minor that will pass. But for people like Michael, it isn't just stress. It isn't just food poisoning. It's the beginning of liver damage caused by a virus that has already found a home in their blood. This is how viral hepatitis hides. It wears the mask of everyday discomfort, so that by the time someone realizes what's happening, their liver may already be scarred. The medical word is fibrosis, the slow replacement of healthy tissue with stiff, lifeless bands. For years, the liver tries to keep working, tries to heal itself, but with each cycle the damage grows deeper. And while patients carry on with their lives working, raising families, exercising, planning for the future, the virus continues its silent work. Until one day, like Michael, the silence ends suddenly, and the damage is revealed too late. So ask yourself this. How many times have you felt worn out without reason? How many times have you pushed aside the loss of appetite, the unsettled stomach, telling yourself it was nothing? For most people, that's all it is. But for millions around the world, it is the only warning their liver will ever give. In the hours after Michael's collapse, and doctors turned to his blood for answers, they weren't looking for exhaustion or food poisoning anymore. They were searching for something deeper, something hidden. And they found it. His liver enzymes ALT and AST were soaring. It was a red flag, a sign that his liver cells were breaking down and spilling their contents into his bloodstream. More tests followed, and the viral screen gave them their answer. The surface antigen for hepatitis became back positive. The diagnosis revealed a hidden truth. Michael had been living with the virus for years. The word itself comes from two simple parts: hepar, meaning liver, and itis, meaning inflammation. Together, it means inflammation of the liver. But behind that simple word lies a group of diseases that can devastate the body in very different ways. There's hepatitis A, usually spread through contaminated food or water, which rarely lingers for a lifetime. Then there's hepatitis B and C, passed through blood and body fluids. Unlike hepatitis A, they can stay inside you for decades, slowly eating away at the liver. For Michael, the virus had been living in his blood without him knowing, quietly causing damage. He didn't remember being sick. He had no dramatic fevers or severe illness to mark the moment of infection. That's how hepatitis B works. It enters quietly and it stays. For many, the first sign comes not in the beginning, but decades later, when the liver is already scarred. Michael's collapse was not the start of his illness, it was the moment the silent battle finally surfaced. The cruel truth is that millions around the world are carrying these same viruses, especially hepatitis B and C, and most don't even know it. They advance in silence, until the damage is almost irreversible. But one question remains, a question that haunted his doctors and should haunt us too. Where did the virus come from? Hepatitis B is not airborne. You don't catch it from shaking hands or sharing food. It travels in specific ways through blood, intimate contact, or from mother to child. So how did a healthy, working man in his 30s, with no obvious risk factors, end up with a virus that could kill him? The answer lies in the hidden ways this infection spreads, and in the uncomfortable reality that many people carry it without ever realizing they are a source. Michael's diagnosis left his family stunned. His wife asked the question that lingered heavy in the room. How did this happen? The truth is, hepatitis B doesn't just appear out of nowhere. It always has a path in, and often those paths are the ones we least expect. For some, it begins in the intimacy of a relationship. Unprotected sex, just a single encounter, is enough for the virus to cross from one bloodstream into another. For others, it hides in the small, everyday habits: a razor left in a bathroom, borrowed without a thought, a needle shared in moments of desperation or carelessness. Even the ink etched into skin can be a doorway if the tattoo parlor doesn't follow strict safety rules. And then there's the most silent of routes, the moment of birth. A mother carrying the virus can unknowingly pass it to her child during delivery. For that baby, infection can mean a lifetime shadow, one that begins before their very first breath. The unsettling reality? You don't have to fit a stereotype to be at risk. Statistically, about 1 in 20 Americans has been exposed to hepatitis B without even realizing it. Behind that number are people who look like anyone: friends, co-workers, neighbors living normal lives, unaware of the silent passenger in their blood. And perhaps the most frightening part of all, once the virus enters, it doesn't make itself known right away. It can live inside you for years, even decades, quietly damaging your liver while you feel completely fine. By the time the signs appear, the disease has often already taken its toll. For Michael, this revelation was devastating. His collapse wasn't the start of the infection. It was the end result of years of unnoticed damage, years during which the virus was hiding in plain sight. And so the question changes: if hepatitis B can be passed so easily and live so long undetected, how many more people are carrying it right now without ever knowing? Michael's story reveals a cruel truth. Hepatitis doesn't strike like lightning. It creeps in quietly, wearing a mask of normalcy. In the early days, the signs are so subtle they're easy to dismiss: feeling tired after work, a wave of nausea that comes and goes, a dull ache under the ribs. Symptoms so ordinary that most people wave them off as stress, bad food, or just getting older. But while Michael carried on with life, the virus was carrying out its mission in silence. Hepatitis inflames the liver, tiny sparks of irritation that, over time, leave scars. First comes fibrosis, the slow weaving of scar tissue through healthy cells. Then, as the years pass, that scarring deepens, transforming into cirrhosis, a hardened, shrunken organ struggling to keep up with the body's demands. And in the worst cases, cirrhosis can open the door to the deadliest outcome: liver cancer. A disease that often appears when it's already too late. This is why hepatitis is so dangerous, not because it's fast, but because it is patient. The liver is resilient. it suffers in silence, and rarely crying out until the damage is beyond repair. But here's the twist. The liver also holds one of the body's greatest secrets. Unlike most organs, it has the power to regenerate. If hepatitis is caught early, if treatment begins before the scars run too deep, the liver can heal. It can rebuild itself. For Michael, the question now was simple but life-defining. Was it already too late, or could his liver still find the strength to recover? As Michael waits for answers, his story mirrors millions of others unfolding across the globe. Hepatitis is not a rare disease, it is a silent epidemic hiding in plain sight. According to the World Health Organization, over 296 million people live with chronic hepatitis B and 58 million with hepatitis C. And yet, the majority don't even know they are infected. The burden is heaviest in parts of Asia and Africa, where transmission often begins at birth or in early childhood. But it does not stop there. In Europe and the United States, new cases are climbing, driven by unsterile tattoos, shared needles, and risky behaviors that spread the virus silently through communities. But these are not just numbers on a chart. Behind every statistic is a human life: a father who never saw his children grow, a mother quietly enduring fatigue and illness, a young adult whose dreams were cut short by liver cancer. Each number represents a story that could have been different if only the disease had been found earlier. And that's the tragedy of hepatitis. It thrives in the shadows, sustained by lack of awareness, missed opportunities for testing, and limited access to care. Michael's case is just one. But multiply it by millions, and you begin to see the scale of a crisis that spans every border, every language, and every generation. For hepatitis, a simple blood sample holds the answer. For hepatitis B, the marker is HBsAg, the surface antigen of the virus. For hepatitis C, doctors look for HCV antibodies, the silent fingerprints of an infection that may have been hiding for decades. These tests, quick, inexpensive, and widely available, are the only way to break the silence. Because without testing, the disease keeps spreading invisibly from one person to another. But here's the good news. Unlike many silent killers, hepatitis can often be prevented before it begins. For hepatitis B, there is a vaccine safe, effective, and available since the 1980s. It acts like a shield, training the immune system to block the virus before it ever touches the liver. Beyond vaccination, prevention means practicing safe sex, avoiding the sharing of razors, needles, or syringes, and ensuring medical or cosmetic procedures use sterile equipment. And yet, millions still go unprotected. That's why awareness is as important as medicine, because protection works only when people know it exists. But what if you are already infected? Here is where science turns the tide of fear into hope. Michael's diagnosis felt like a life sentence. But here's the truth. For many, hepatitis is no longer the end of the story. For hepatitis B, science has not yet found a cure, but it has found control. Powerful antiviral medications can suppress the virus, keeping it asleep and protecting the liver from further damage. With lifelong monitoring and treatment, patients can live long, healthy lives. For hepatitis C, the breakthrough is nothing short of revolutionary. What once required painful injections with low success rates has now been replaced by direct-acting antiviral STAs. A simple course of pills, often just 8 to 12 weeks, can wipe the virus out completely. Yes, cured. Across the world, patients who once faced certain decline are now celebrating recovery. The stories are real. Mothers returning to their families, young professionals resuming their careers, and people like Michael rediscovering hope after despair. But medication is only part of the battle. Lifestyle matters. Patients are urged to avoid alcohol, which accelerates liver damage, and to commit to regular checkups. With the liver's extraordinary ability to regenerate, catching the disease early and supporting it properly can mean a second chance at life. Michael's journey is far from over, but today there is hope. With treatment, his liver has stabilized, his energy has returned, and his family stands beside him, stronger than ever. But here's the truth you cannot ignore. The first warning sign was something so ordinary: fatigue. The kind of tiredness we all dismiss after a long day. For Michael, it was his liver's silent cry for help. So I ask you, have you ever felt unexplained fatigue? Comment yes or no below. Your story might inspire someone else to get tested. And remember this: hepatitis is a silent disease, but it doesn't have to be a deadly one. Get tested. Get vaccinated. Protect yourself and those you love. Share this video, you could save a life. Hepatitis may be silent, but together, we can make the world listen. Don't forget to subscribe to HepatitisB for more intriguing medical tales.